Hello students, I am back to teaching community medicine. Today we are going to see national health policy. If a student giving community medicine talks about national health policy, then we examiners will be more than happy to give you pass. Even we will be willing to give you gold medal or honors because it implies that you have studied in-depth community medicine. But at the same time, this national health policy is very simple to write. You have to just understand there are only four components in writing this national health policy. It may be undergraduate or postgraduate exam. First of all, you have to write about the history of national health policy. Secondly, we have to write about what is the goal of national health policy. Thirdly, we have to write about what are the objective of national health policy. And fourthly, there are four specific subcomponents in national health policy. This will be broadly covered under 1, 2, 3, 4 headings. So with the help of this mind map like thing, we can easily memorize, recall and easily say the answer and write the answer. In any question on national health programs, national health policy can be mentioned. That is one another advantage. So then what is the history of national health policy? It is very simple. In 1983, the first national health policy was framed. In 2002, another national health policy was framed. Now this the latest one is 2017 national health policy is there. So year on year we are seeing some improvement in health statistics. So what is the goal here? The goal is very simple: attainment of the highest possible level of health for all ages. So this is what is important: the attainment of highest possible level of health for all ages through preventive and promotive health. Okay, that is the goal. What is the objective? Remember, goal is always a broad thing. Objective is something we are using to achieve the goal. So objective will be little bit more specific. So what is that specific thing? The goal is highest possible level of health. To achieve that, we need concerned policy action. There should be a proper concerned policy action through the use of preventive, promotive, curative, palliative and rehabilitative services in all sectors. So concerned policy action through preventive, promotive, curative, palliative and rehabilitative services, PPCR. So the objective is concerted policy action through PPCR. Now we will come to the subcomponents 1, 2, 3, 4. There are four subcomponents. First is health status and program impact. So this is what we have to measure. So what is the present health status and what is the program impact and what we are striving to achieve? That is the first one. To remember this first component, I will use the symbol like this. One is we want to increase something. Another one is we want to make it progressive. Another third one is we want to decrease. So this is the first objective which we can remember like this. What is this increase, progressive and decrease? First one, we want to increase the life expectancy from 67.5 to 70 by the year 2025. So we want to increase. That is the first point. Second point is we want to use DALY, disability adjusted life years. So we would like to use DALY as a measure for measuring the disease burden, all disease burden. Presently, we don't measure every disease in terms of DALY. But as per national health policy, we would like to use DALY as a measure of disease burden. So that is a progressive thing for all diseases. Third one, what we want to decrease, reduction of total fertility rate to 2.5 by the year 2025. So there are 3 points which we discussed. By the year 2025, the first one we want to do is 70. That is 70 is the life expectancy. Second one we want to do is DALY, disability adjusted life year. Third one we want to do is total fertility rate, which should be brought down to 2.1. Just remember this mind map. But remember, in the health status and program impact, this is the first one. Here we are seeing about life. Now second one, B. Here we are going to see about death. In death, all three are going down only, which means usually in death we want to see reduction in death, is it not? So the three deaths which we want to reduce, three mortality which we want to see reduction are under 5 mortality. First one is under 5 mortality and maternal mortality. Under 5 mortality we want to bring it down to 23 and maternal mortality maternal mortality rate, we want to bring it down to 100. This is 23 per 1000. Maternal mortality is 100 per 1 lakh. The second one is we want to reduce infant mortality. Infant mortality should be reduced to 28. Then neonatal mortality. You know the neonatal period. We want to see reduction in neonatal mortality to 16 per thousand. So all these things, when we want to achieve, we would like to achieve it by the year 2025. Now coming to the third component of in the health status and program impact. Here we want to see the reduction of disease prevalence. Here also we would like to see the reduction of disease prevalence. Overall disease prevalence for HIV, we use the term 90, 90, 90. What are these three 90s? 90% of people who live with HIV knows that they have HIV. That is the first 90%. Second one, 90% of those people should get adequate antiretroviral treatment, sustained. So that is second 90%. The third 90, those people who receive this antiretroviral treatment, they achieve viral suppression. 90% of those people achieve viral suppression. So 90, 90, 90. Secondly, we want to see elimination of three diseases. Remember, this is often asked. You know, leprosy is eliminated from India. So we would like to eliminate leprosy even from the endemic pockets. Small pockets of high leprosy situation is there. So those endemic pockets, we want to reduce leprosy, Kala Azar and lymphatic filariasis. So we want to see reduction of leprosy, Kala Azar and lymphatic filariasis. Thirdly, we would like to reduce the prevalence of blindness by 0.25 blindness. Fourthly, we would like to achieve 25% reduction in pre-mortality due to hypertension, diabetes, cardiovascular diseases, cancer and chronic respiratory disease. All these things should again be achieved by 2025. So now you are clear with the first component of the program, health status and program. That is these three subcomponents. One is increase sustained level, decrease. Second one is all three factors are decreasing. Third one is we want to see the decrease in disease prevalence. So if you understood this, we would move to the next one, second component. So now I will just rub it off this portion because of lack of space. First we saw health status. Now second we are going to see that health status is because of a health system. So in national health policy, the second component is we are going to see the health system performance. In health system performance, we have only two main components, not like before there were three main components. Here we are going to see two things. First one is coverage of health services, how far the health services are covered. Second one is cross-sectoral goals with respect to health. So in coverage of health services, obviously the usage of government services is very poor, government health services. So we would like to increase the usage of government health services to at least 50% by year 2025. Second one is we want to achieve at least 90% coverage for usage of health services by antenatal mothers, the attendance of delivery, skilled birth attendance is essential. At least 90% should be achieved for antenatal care and skilled birth attendant for delivery. At least 90% is the target that should be achieved by the year 2025. So 50%, 90%, another 90%. That is 90% of children should be at least fully immunized for their age by the year 2025. Next, another 90%. Here 90% of family planning needs should be achieved by those who need it. It should be achieved, at least their 90% need should be achieved by the year 2025. Temporary method of family planning or permanent method of family planning, it is the need that determines. After 90%, lastly we have 80%. Here the 80% is for diabetes and hypertension. At least by the year 2025, 80% of diabetes people and hypertensive people have their disease under control. So that is 80%. So in health system performance, we have the coverage which is 50%, 90%, 90%, 90%, and 80%. With these numbers, you can just recall and remember the points. Now coming to cross-sectoral goals. See, previously we saw in health status, leprosy, AIDS and all, we want to see reduction, elimination, like that we saw. But here in cross-sectoral goals, we want to see reduction of certain problems which are indirectly related to health. For example, tobacco use. Tobacco is not a disease. So the tobacco use should be reduced to at least 50%, 15% or 30% by the year 2025, 15% by the year 2020. So first one is tobacco reduction we want to achieve. Next one is water. We would like to ensure that by the year 2025, at least all the people have got access to safe water and sanitation. So this is also indirectly related to health, cross-sectoral goal, tobacco, water. Next one is occupational injury. That is occupational injury, especially among farmers, that is agricultural workers. Right now it is 334 per 1 lakh. That is occupational injury. We would like to reduce it by 50% by the year 2025. So these are the cross-sectoral goals. Now you understood the second component. First we saw about health status. Second we saw about health system. In health system performance, we saw the coverage of certain health indices. Public health facilities should be utilized 50%. Antenatal services, skilled birth attendant 90%. Fully immunized, second 90%. Third 90%, meeting the family planning needs. Last 80%, that is diabetes and hypertension disease control. So that is health system performance. Then cross-sectoral goals, we want to reduce the tobacco usage by 30% by 2025. We want to have access to safe water sanitation by 2025. Reduce the occupational injury among agricultural workers by 50% by 2025. Now we completed the health system performance. So with these two things, we had an idea about the current situation and how to improve. We have set a target. Now the third thing is how to achieve the target. So that is the third thing. So I will rub it off. We will come to the third part. So how to do that? We have to do strengthening. What to strengthen? We have to strengthen the health system. Here we are going to see health system strengthening. How to do the health system strengthening? We can use three methods in health system strengthening. A, B, C. So the first one we saw three components. Second one we saw two subcomponents. Now health system strengthening, again we are going to see three subcomponents. So system strengthening means what? We have to have adequate cash in hand. So this is my picture of a money. This is 100 rupees note. So why I have drawn this here? This is a picture. So this will give you a remembrance about health financing. So money we need. Next, what do we need? We need people to carry out the function. So who are all the person involved in the delivery of the health system? So we have to ensure that adequate people are available. So that is the second subcomponent. Third one is, even though we have money, even though we have people, we have to properly manage them, whether the money is flowing properly, whether the people are working adequately. So we have to see that. So how to see that? We have to use a feedback system. And it's a huge system. Our country is a huge healthcare system. So what do we need? We need electronic computers to collect the data. So the database management is very important here, to collect the data and then see whether they are performing. So that is management part. So we have three things. Now the picture would have given you a good idea about what we are going to see. So first one is financing, health financing. Our percentage of health financing, usually our country's economic performance, our strength is gross domestic product, our GDP. So with this GDP only the budget will be made. For Indian Army, usually the budgetary allocation is more 10%, more than 10%. But when it comes to healthcare, comparatively, we have just 1%, 1.15% is the government spending. 1.15% GDP is the government spending for healthcare. So we would like to increase it to at least 2.5 by the year 2025. Similarly, state health sector, state health budget also, this is a national budget, state health budget also, at least 8% of their budget should be allocated for healthcare. And most importantly, we would like to reduce the catastrophic health expenditure by the people. By at least 25%, we have to reduce the health expenditure. Unnecessarily, they are wasting money on health, even though the government facility is available. But the government facility is not adequately funded. That's why people are going to private. So the national health policy says we have to increase the GDP on health. So second strengthening of health system is manpower and building. So first of all, we would like to ensure that the paramedics and doctors, adequate paramedics and doctors and nurses are available for healthcare by the year 2025. Secondly, we would like to increase the community volunteers. Government is not willing to spend on doctors' salary. They would like to pull in more people, volunteers. So we did not pay money. They will work for healthcare. So they are volunteers. They want to increase the volunteer population. So just they have mentioned no number. Just they have to strengthen the volunteers in the healthcare. And thirdly, infrastructure. That is primary and secondary care facilities. PHC and community health centers, the primary health centers and community health centers, the primary and secondary health facilities should be fully constructed and in operation in high priority districts, especially high priority districts like tribal area, difficult to reach areas and all. There are no PHCs. So they have to ensure, the government is trying to make it a policy that at least there, in the high priority areas, a PHC and community health centers are there by the year 2025. So that is manpower and infrastructure. Third one is management part. So how to see the people and the system is working. So we have to maintain district-wise electronic database. These days, a paper system is slowly moving out of the government offices. Nowadays, everything is electronic. Aadhaar card has come and all our details are entered in the Aadhaar card. This is one government database. Similarly, in healthcare, how many diabetics are there? How many hypertensives are there? If everything is put inside the electronic database, definitely lot of work will be saved for the government as well as for the people. Secondly, health surveillance system is there, no? So we have to collect the data regarding sexually transmitted diseases, HIV, tuberculosis, malaria. So how they are collecting? Through the surveillance mechanism only. So they have to ensure that adequate surveillance mechanism is there in place, at least by the year 2025. Lastly, National Health Information Network. This is a very important network. So this National Health Information Network will give us an idea about the magnitude of a disease problem. Each and every disease problem magnitude will be made available through National Health Information Network. So this should be strengthened. So this is the computer part. So now you would have understood clearly the money part, the manpower and infrastructure part, and the management part with the help of computer. So the third component is over. Actually, you would have read only the first, second, and third components: the health status, the health system status, and third one is health system strengthening. But to really achieve something, the government should have that mindset, the mindset to do the thing. That mindset will come only when there is a policy. The fourth component is nothing but policy. What the government policy is towards these targets. So like before, I will just rub off the things. So the fourth one is policy thrust. Policy thrust. Only if you push something, things will happen. So the policy thrust. In the policy thrust, there are two components, A and B, very simple. The first one is ensuring adequate investment. Even in the third component also, we saw in health system strengthening, the GDP should be increased from 1.15% to 2.5%. Same thing is here, but here the 2.5% GDP is made as a government policy itself. Even though it is made as a policy, still it has not come to 2.5%. This is year 2023, remember. I don't know whether in the next 2 years this number is going to increase or not. And B is the government programs. To achieve those targets, the government has incorporated numerous programs. There are 7 programs. I will tell you one by one. First one is the Swachh Bharat Abhiyan. You know very well. So this is cleanliness awareness. First one. Second one is exercise and regular diet. This is coming under the National Program for the Cardiovascular Diseases. Third one is addressing tobacco and alcohol use. This is also coming under the National Cardiovascular Diseases Program. Fourth one is Yatri Suraksha. Yatri Suraksha is prevention of road traffic accidents That is why this Yatri Suraksha program is there. Fifth one is Nirbhaya Nari. Nirbhaya Nari, you must have heard the term and the name. Definitely, I need not explain these things. So, this is for prevention against gender violence, Nirbhaya Nari. Sixth one, reduced stress and safety in workplace. So, this is the sixth one. This is a national priority for healthcare and health system strengthening. Lastly, reducing indoor and outdoor air pollution. So this air pollution is a indirect health problem. So these are the policies, government policies towards the achievement of good health status, health system performance, and health system strengthening. The previous three things. So I think I have given you in a nutshell a broad mind map which is easy to understand and write in paper and answer to your examiner. So watch this video again and again to get a complete understanding of National Health Program. I think videos like this will be very helpful for your exam preparation. I have many such videos, mind map videos for National Health Programs and communicable diseases and all topics of community medicine. To see those videos, kindly become a member. If you become a member, it will benefit me. In a month, you can cover the videos and then you can unmember yourself. It is up to you. So if you like this video, press the like button. Kindly subscribe our channel Community Medicine Made Easy and press the bell icon for more such videos. Meet you on the next video. Until then, goodbye from Dr. Karthikeyan. Thank you.